Hello, Mark.
Hi, Doctor.
Hi, I'm Seshni. I'm Dr. Mudlia.
Yeah.
I've just seen Mr. Ali. I understand your prisoner that you've been looking after.
Oh, yeah.
And I've come to talk to you more about my findings.
Yeah.
But before I begin, is there anything you want to tell me about what you've noticed with Mr. Ali?
He just needs to get out of here. I mean, he's fine now. When he first came in, okay. But right now, just get him out of here.
Okay, well, let's have a discussion, and then I can tell you more about what I think the management plan would be. But I take on board what you're saying is that he might be better and he could go back into the cells. Yeah. Okay, so tell me how Mr. Ali was presenting.
So when he first came in, well, he was sort of said he could hear voices. I mean, I reckon that was just the water pipes and stuff like that. You know, a lot of the prisoners come in here and they try it on. So I thought, let's try this on. He'd taken something, which obviously didn't help. And he'd had a few episodes in the past. But when he first came in, I don't know, I think he's trying on.
I can see that it sounds like it seems quite difficult with him. I understand that you've said he's been hearing voices,
Yeah.
and he might have taken a substance. Do you know what he might have taken?
Yeah, apparently he was taking cocaine, he got cocaine.
Okay, and is that confirmed? Has anyone
Yeah.
done a urine drug screen? Or?
Yes, the tests have come back, yeah, he's had something.
Okay, and do you know, I understand from the information that I was given that he witnessed an assault?
Yeah, well, that was a few months ago now. Yes, he witnessed it as an assault. He's been a bit withdrawn since then. But, you know, he's new to this country, you know. There's all sorts of things going on with him. He certainly doesn't need to be in a place like this.
Okay, and you think he can go back to the
Yeah,
cells?
absolutely.
Yeah.
There's no reason he should be here.
The other thing is, Mark, I think the information that I was given was that he tried to assault one of the prison officers.
Yeah, so he got a razor blade, and it was during a routine search. He tried to use that on one of the officers. You know, it's part of the course in a prison.
Yeah.
This is what they all do. We put them all in here because they're trying to attack a prison officer. This place would be full every day.
Yeah. So, I mean, was the prison officer injured in any way?
No, he didn't manage to do anything.
Okay. Do you know why he was carrying the razor blades?
Well, since he's seen this happen a few months ago, there was an assault on another prisoner, from another prisoner, and since he saw that, it sort of unnerved him. So apparently what's happened on the wing is that he became a lot withdrawn after seeing that incident. So I don't know if that plays in his mind or not, but hey, you've got to get over those things.
Okay. My understanding was he might have been carrying it for protection as well. Do you know whether that was the case? Like he was...
He does say that since that, then this is for him for safety. If that's what he's got, why attack another officer who was there to help him?
Yeah. So from what you've told me, Mark, it sounds like Mr. Ali, there's been a decline in his mental state. He's been hearing voices and behaving a bit like he's paranoid about the prisoners and the prison officers. And he's been at a risk in terms of taking cocaine and also attempting to attack people with razor blades.
Yeah.
So, I mean, I'm going to discuss with you, and I mean, you can tell me what you think about what my findings are. But from what the discussion with you and also seeing Mr. Ali, my understanding is that it's possible that my differential diagnosis is that he is suffering with a mental disorder, most possibly a psychotic episode. But I am taking on board that the other differential would be that it could be due to cocaine use or substance misuse, that he's presenting with a disorder because of that. And then the third thing is that he could be depressed with psychotic symptoms. I'm not sure if he presented as being depressed following, seeing the assault.
He, from what I'm told by the prison officers known well, is he has gone down in terms of talking to people. You know, he's very withdrawn. He feels very low. He doesn't come across like he was when he first came in.
Yeah, so it's possible that he might have been depressed with psychotic symptoms. The other thing is maybe schizophrenia, like an underlying mental illness, which obviously I don't have any records of his past history.
No.
I'm not sure if you were aware.
I don't have any past history.
Okay, so I mean, what I would like to tell you more about what I think the management would be. Obviously, we would need to exclude any physical causes, so we do need to do bloods, to check his bloods out, to rule out any infection or anything else that could be wrong. And we also need to do a urine drug screen again. I know you said you've done it, but it would be good just to test for any other substances he might have had.
Right.
Yeah. The other thing is I've taken on board you. I think you said, Mark, you want him to go back to the cells, but I think he needs to stay here. This might be the best place to observe him, and also to observe any changes in his mental health, and also to monitor his physical health as well. I'm just concerned that if he goes back to the cells, he continues to remain a risk of harm not only to himself but also to others if he's carrying razor blades.
Yeah, well, we can do the bloods. I can get the bloods done today. We can sort out the bloods and the tests done today. But I'm not sure he needs to be on the wall. He does not need to be in this unit.
Yeah, no, I understand, Mark. I know it must be difficult managing, obviously, prisoners that end up being sort of physically and mentally unwell, but I can assure you, because of what he's presenting with, like I've explained to you, a possible underlying psychotic episode, I think he needs to stay in this unit. He also needs to have treatment in terms of medication, so I will look at the options and have a look. I first need to get more collateral information, to speak to other prison guards, any of the cellmates, and also get some information from his family and his GP records to exclude any other causes, and to get more history to make a diagnosis. And then I need to get, later on we can think about psychological talking therapies, which might be useful because of what you've told me. He obviously observed an assault, which could be something that's affecting him. And then obviously get some social intervention in terms of looking at the visits he's been having when he's much better. Does that sound all right with you?
Yeah, as long as we can get on with this pretty quickly.
Yeah. Thank you again for talking to me, Mark, about Mr. Ali, and I've told you more about my possible diagnosis and also the management plan.